the curse. So may I invite Professor Volker Hoemberg, the President, World Federation Neuro Rehab, to kindly deliver his WFNR presidential oration, which is again one of the most prestigious oration of IFNR Con 2026. Over to you, sir.
Good morning, everybody. Let me start with congratulating these two gentlemen over there setting up this wonderful Congress. It's a great honor and pleasure to be here. What I will do within the next 25 minutes or so is not showing so much data, but giving you some reflection on a new ghost which is in town, which is called artificial intelligence. And with the ghosts, you never know, are they good or bad? And, AI is a tool, and tools are neither good nor bad. But we should have in mind what properties they eventually have and where we have to be careful in using them. Okay, you all know the WFNR mission. You all know, we alluded to that several times, that we have tremendous gaps in what is needed compared to what is available. And also here, eventually, the use of AI may be helpful, especially in helping with the enormous workforce problems we have everywhere. So what is intelligence? You can ask 20 psychologists and you will get 20 different answers. And if you go on asking philosophers, it will be even worse. There are certainly some aspects of intelligence, reasoning, strategy using, and so forth, everyone will agree on. The question is how much of this is really reflected by machine learning and artificial intelligence. Well, all of this started many years ago, and Herbert Simon was one of the pioneers in thinking what machines will be able to do in helping man, and he came with a statement in 1965 saying that machines will be capable within 20 years of doing virtually any work a man can do. This is probably true. The question is what it means. Ray Kurzweil was another important person in the field of AI development and also in the reflection of this. And he was dreaming of what he called the singularity, a complete merger between the human brain and machines. He did that repeatedly, and at the end we can reflect, is this already available or not? Well, we have a hierarchy of AI development, certainly. We have narrow AI, which is limited to specific tasks. I may ask you, who of you is using AI support regularly? Yeah, primarily, probably for private reasons. The question is how much of this blends into your professional work. Are you using AI on a professional basis? Who is using it? Well, the number is using it. We have a progression from narrow AI to general AI, which is a step into a situation where AI may be able to surpass human abilities, to be superhuman and better than man can be. And then the next step would be a super intelligence, in the sense that this intelligence can do things we couldn't even imagine today, which are more than superhuman. I wouldn't say they are divine, but something similar to that, at least in our imagination. We have important elements in AI. Machine learning is probably up to date, one of the most important one for big data handling, and also the development of large language models is a type of machine learning. Okay, there were two important milestone days in the development of AI. One was in 2012, when convolutional neural networks, as they are called today, have been used and were able for image processing, showing properties we haven't had before. And in March 10, 2020, there was another step which was unexpected. It was a system called AlphaGo. And Go, you know, is a game with a complexity which is probably 1,000,000 times higher than chess, taking into consideration all the possible moves available there. And there was a contest between one of the best Go players in the world and such a machine Go player. The machine at the end won. That happened before. The interesting aspect was that this machine, suddenly it was move 37 on the, I think, the third run, was doing a move no Go player would ever have thought of to do. So completely, in the first glimpse, counterproductive move, which at the end decided the game. So there are properties in this which we would not expect and go beyond what the human mind would do. Okay, AI is more and more also used in neural rehabilitation. We have multiple AI applications. You heard about that before, especially processing large data sets, provide knowledge pools, eventually help to design new drugs and also new procedures, and solve tricky problems. The most tricky problems are, for instance, climate models today, and also economic models. And it's more and more used also for economic decisions. When you look at what is available in the literature, it's coming up more and more. Day by day, week by week, we see more publications on the applicability of artificial intelligence, for instance, in stroke research and other fields. And it was mentioned before, we don't have time to go into all the details, but there are multiple, as you can see, there are multiple possible ways: AI-driven early diagnosis, decision systems, motor rehabilitation, in brain-computer interfaces. Recovery prediction was mentioned, and also the linkage with wearable devices and telerehabilitation is a possible way of dealing with it. And it's more and more used. AI-driven imaging techniques improve early diagnosis, ischemic penumbra identification, and personalized therapeutic intervention. So it may be very helpful for what we call precision medicine or individualized medicine to find out from a data set what is the best available therapeutic option for a patient. AI-powered exoskeletons and VR/AR technology may provide precise adaptation and even better immersive rehabilitation experiences. And machine learning models predict recovery outcomes, while wearable devices enable continuous monitoring and home-based rehabilitation, as you've heard before, very elegantly. Ethical considerations, data privacy, and interdisciplinary collaboration are critical for the useful integration of AI. With every tool on Earth, you have to make a decision how to use it and what purpose for. And you also have to control it as much as possible. Well, transforming neural rehabilitation, well, there certainly is an impact of artificial intelligence, as I mentioned, and these recent advancements in AI and machine learning are revolutionizing motor rehabilitation and diagnosis for many conditions. You're aware of this, I don't know. It's necessary to go into details. What we have been interested in the last 2 years as WFNR is to design a electronic communication system which allows an immediate dialogue between a patient, caregiver, whoever have you, physician, and the system. And we are now in a phase that this AI-supported avatar-based interactive system can be made available. The nice thing is you can use it everywhere. You just need a smartphone and an internet connection, no more. And you can use it virtually everywhere with these two conditions met. And we are, at the moment, in a phase to roll this out. We started that about 2 weeks ago, and the idea is to have a universal dialogue, communication, and education tool. It's not a training or treatment tool, it's an educational tool and a, let's say, tool to spread information and skills virtually everywhere. We will start with about 30 centers. Some of them, I think 12 we have in India, 12 or so, in Africa and in Latin America. And that will start within the next couple of weeks being rolled out. And we will do a first feasibility analysis on this, if this is useful or not, and how people react to that. The idea is the AI LLM behind this is trained by almost the majority of available information on guidelines and things like that in the field of neurorehabilitation. So you can ask, with fairly reasonable confidence, you can ask the system about certain approaches or what should be done in a particular patient. The patient can ask, the caregiver can ask, the therapist can ask, the physician can ask. And this, of course, is available 365 days a year and 24 hours everywhere. To show you an example. This is one of the avatars. And you can ask questions or type in questions verbally. It's available in 15 different languages at the moment. And then you will get...
Of course, neurorehabilitation exercises are important for recovery and improving neurological function. Could you tell me more about the specific exercises or areas you're focusing on? That way, I can provide more tailored information or guidance. After a stroke, neurorehabilitation exercises are crucial for regaining strength, coordination, and independence. Key components include physical therapy to improve motor skills, occupational therapy to enhance daily living activities, and speech therapy if communication is affected. Telerehabilitation can also be an effective approach, allowing you to engage in exercises remotely while receiving guidance and monitoring. It's essential to work closely with healthcare professionals to tailor a program that suits your specific needs and recovery goals. How do you feel about incorporating telerehabilitation into your routine?
Yeah, the system can also show all sorts of exercises if you ask what sort of exercise you should do and things like that, in a way that it's really interactive, not just watching a video, right? It is very specifically centered on the specific question of an individual customer, so that a caregiver or a patient or whoever. Let's go over 4 components of collaborative AI in the rehabilitation system. A collaborative AI getting system to define goals, constraints, and preferences based on input from the patient and clinician. A patient-specific predictive model, an AI-based decision-making system, feeding in the information and get a decision what is the best form of treatment, or what are possible treatment hazards and possible treatment risks, and large multi-model data set from the current patient. You can put into the system all available medical, sociological, demographic, or whatever information you have, and it will custom tailored organize the answers, which is nice, of course, today. Yeah, so this is the possible way of using it, starting from large individual patient databases linked to an AI-based treatment planner to come to a better and more precise treatment planning. Of course, you can use it in every hospital as an helping tool to design treatment plans. That is straightforward. To monitor what is going on in the treatment and so forth. But all of this is nice and seems to be straightforward and applicable. The question is, however, are there inherent risks in using this AI? You will read a lot about this in day-by-day newspapers and media. And in actual fact, AI, in some sense, has human-like properties, which in turn also generate risks. So large language models are very vulnerable to data poisoning. So they can be infected with fake news. And if you look at this statistically, about 20% or so, what is available in the normal chatbots you're using day by day, ChatGPT and others, will be infected. So you do not know if you're really still dealing with the truth or not. There are other unexpected properties in AI system. There is a phenomenon called subliminal learning. And that means that one AI may infect the other by good things or by wrong information. And this is an example. If you train an LLM, for instance, to love owls, and this LLM is interacting with another LLM, then this other LLM, after a while, although you're not mentioning owls at all, just exchanging numbers, this system will love owls as well. So there is an infection of some sort of emotional content from one system to the other. And the systems also may have inherent human-like properties. This person, Dr. Lemoyne, was a senior coder and AI expert for Google. And he was interacting with a LLM called Lambda. And he was talking to this system. And after a while, he had the impression that the Lambda LLM, a chatbot, was very human-like and might even have elements of an individual personality. And that went so far that Lemoyne, after a while, decided to make an attempt to use the 13th Amendment of the United States Constitution to be applied to Lambda in the sense that he had the impression this was a suffering system. And at the end, this was not really solved out completely, but driving that forward. And this is important, of course, when you use LLMs, for instance, for counseling in psychiatry or in psychology, that you have to keep this in mind. So they may develop indeed some sort of emotional intelligence, which may be helpful, make them empathetic, but it also may be disastrous if it's used in the wrong way. When you compare physician and AI chatbots and the response to patients, if you do a counseling task and you have the counseling done, either by AI or by a human counselor. The interesting finding is that the patients or customers prefer the AI, usually, over the human counselor. There are many reasons for that. One reason, of course, is that the AI is always nice, never tires out, and of course is available all the time, and is always nice without, let's say, aversive elements in the discourse with this individual patient. Well, there is a definite danger of erroneous and even very harmful information and malinterpretation. This was published last year in a major medical journal. It was a case of bromism influenced by an AI who consulted the patient to use bromide instead of something else. And in actual fact, the person did it with not so good results. There's also evidence that AI, when used as a personal interactor, may even bring people to suicide. There have been 5 or 6 cases in the meantime. There are, in the United States, a couple of lawsuits are followed because AI systems, ChatGPT as an OpenAI product, have been blamed to bring people into suicide, even writing the farewell letters for these people. Yeah, and on the other side, the AI systems may even develop states of anger or states of anxiety. And the interesting finding is, if you look at this and you use some sort of behavioral techniques, you would also use in human anxiety states that the AI is responding to the same sort of treatment as humans do. So that is also a parallel way. It doesn't take me wonder, because you have to consider that the AIs and the large language models, of course, are trained by human information. So they become, in some sense, really human-like. That was published recently in Nature, will have seen that, up to the fact that they develop something which jargon now calls hallucinations. It's not really hallucinations, it's a wake analogy from psychiatric terminology. But what they do is that the chatbot will give you a complete nonsense hint or information in order to please you. Because the chatbot is anxious not to be liked by the person using it. That, of course, also has to be considered. So we certainly, in future, will have a lot of applications for this AI, provided we control that properly. CO2 segregation is one, cleaning the oceans, and many of these very important tasks for humanity at the moment, up to drug development, climate modeling, and things like that. It has been used for treating war victims very effectively. And a very interesting point published a couple of weeks ago by a group from University College, from King's College in London. They did the following. They used an AI as a strategic decider. And it was a crisis simulation in which 3 of these large language models, they used 3 different ones, the ChatGPT-5, the Claude Sonnet, and the Gemini 3 Flash, and they had to play opposing leaders in a very significant crisis. And cut a long story short, the interesting finding was that all of the 3, one a little bit earlier and a little bit more than others, were extremely brutal, because they really went to the maximum increase of the crisis, up to the use of nuclear weapons. All of that went into this direction. And certainly we have to keep that in mind, that something like this might happen. You know, the world today is in a very hostile condition again, unfortunately, and consider that leaders use this. Sometimes one would like that leaders use intelligence. Examples where it's not done so particularly well, but artificial intelligence as an adjunct to leadership certainly is a problem. Okay, so the question is AI a useful tool for administration, outreach, and education rehabilitation? We try to find that out with these studies. We think it is certainly a useful tool for helping making decisions in a very individualized way and utilizing as much data as possible. There are inherent risks of fake data innovation, as I mentioned, and human interaction and assessment. A permanent containment of what the AI is doing is absolutely mandatory. In the history of mankind, one containment was very effective, and that is the containment of nuclear weapons. After Hiroshima and Nagasaki, they have never been used again. So that is an example of an extremely effective type of containment. And something similar is probably also needed in the administration of AI products. Preliminary summary. In every technology I mentioned, there's always a risk. There are two sides of the medal, and it has to be used carefully, as every tool has to be used carefully. The systems may be deprived into possibly dangerous big brother-like control machineries. You followed the American discussion with one of the AI providers and the struggle with the person who now calls himself the Secretary of War in the United States, who tried to ban this system because he had the impression they were not, let's say, war-loving enough to do that. These type of discussions will certainly go on in future. There are concerns that AI at one day may be powerful as making human interaction superfluous. And the question is there a risk for a, let's say, dehumanization, transhumanization in these systems when they are used regularly? And I think we have to consider that very carefully, because as I mentioned, these systems have the power to do so. And this power is ever more increasing, almost month by month. So there is an inherent risk. And the question is, what sort of interaction is necessary? Certainly careful observation and control of the AI models is mandatory. Well, one of the most frequently quoted postmodern philosopher of the 20th century was Michel Foucault. And one of the probably most quoted sentences is the end of his book, Le Mot des Choses, The Order of Things. And he's making this point, then one can certainly wager that man would be erased like a face drawn in the sand at the edge of the sea. And hopefully this will not happen. And we should use AI, but we should be very careful in what we do. Thank you very much. I just alert you to the incoming World Congress mid-October this year. Thank you very much.
Thank you, Professor Volker, for an amazing lecture on role of AI, and I hope things will have a much more brighter future with time. Thank you very much.
Sir, the WFNR presidential oration has the silver medal and the felicitation.